know that about 30 to 40% of cancers are preventable based on lifestyle choices, not smoking, less drinking, exercising more, proper diet, and that's a very important part of this strategy. But there's also more we need to do in relation to the delivery of services. We need to listen to the voice of patients who have told us that they're receiving a good medical service but want to receive psychosocial supports, patients who've told us that their cancer journey does not end when their acute hospital journey ends and that they need supports back in the community as well. We need to face the reality in terms of the fact that more and more drugs are coming on stream that can improve outcomes for our patients. We need to finish the centralisation journey to make sure our patients are having their surgeries carried out in the appropriate location. And we need to staff our service, both in terms of medical oncologists and many more nurses. So this is an extraordinarily ambitious strategy. There is nowhere to hide. It's very clear in terms of its objectives, and it will be reported against annually as well. I just want to pay huge tribute to those who worked so hard, both clinically and the team led by Professor Kennedy in producing this superb document, and also all of the patients who fed into this, and indeed voluntary organisations through the Variety Fora. Today is not the end of the patient's input. We are going to establish for the first time a Cancer Patient Advisory Committee to continue to advise me and government and the HSE on both the implementation of this strategy and also on the development of policy. Empowering the patient and making sure their voice is heard is so important. So today is just the launch of the strategy. The hard work in terms of implementation begins now.
How much money is going to be needed for this strategy? Will the money actually be there to implement this strategy?
This strategy is going to require significant investment. It is a 10-year strategy, and I would estimate that by the end of the lifetime of the strategy, we will be spending well over 100 million more each year in revenue funding on cancer if we're to be serious about implementing this. Now, obviously, that needs to be done incrementally, and indeed the strategy talks about it being done incrementally. There's also significant capital costs, as Professor Kennedy correctly pointed out. We have lost a decade in terms of investment in much of our capital infrastructure. If we're serious about, and we are very serious about, extending programs like bowel screen to make sure every citizen in this country can receive a bowel screen from the age of 55 to 74, we need to put in place the facilities to carry out colonoscopies. So there is significant capital costs as well. The government is very committed to doing this. As Minister for Health, I have to go about this in the normal estimates process, and it's important to say that there's already about €11 million in place for 2017 to get on with the job of improving cancer services.
Minister, there were some strong words from Professor Kennedy about attracting back professionals and retaining them. How are you going to do that when we have had difficulties in the past?
Well, the Professor is entirely correct, and indeed is an expert in relation to this, so I take what he says very, very seriously. But how we're going to do it is we are going to make sure that people who come out of our universities with medical qualifications and want to make a difference in terms of patients' lives and using their expertise have the opportunity to do that. And you do that by providing people with an opportunity to make a real contribution. I think today we're sending out a very strong message to anybody graduating that we in this country are serious about improving cancer services, that we have a new national cancer strategy that's ambitious, and also if you look at the specific recommendations of the strategy, that we want to actually provide dedicated protected research time for our medical students as well, and indeed our medical professionals, so that they can continue to develop their skills. I do think it's important, though, when you talk about the retention challenges, which do exist, it is important to look at the figures recently published, indeed last week, that show there's almost 700 more nurses in the Irish Health Service this year than last year. So some of the measures we've begun to take in terms of nursing are beginning to yield progress. We hope to take on a number of new medical oncologists next year, and we will need hundreds of more nurses to work in the area of cancer care over the lifetime of this strategy.
Minister,